Hi everyone, okay, my name is Ruben. I'm from MO2 and today I'm going to be explaining about the drug doxycycline. Now it's important to know that doxycycline comes from the subclass of drugs tetracyclines, which are known as semi-synthetic antibiotics. Now I'm just going to give you a brief history regarding doxycycline. Now we're going to go back to the 1940s first, when there was this American company known as American Cyanamid discovered tetracycline, which is basically the first class of tetracyclines, as you would say. And a few years following that incident, this special drug company known as Pfizer is going to find terramycin, and then finally this specific individual named Lloyd Coroner is going to make the first synthetic antibiotic known as tetracycline. Now that comes with the birth of doxycycline a few years later, after they have improved the stability and the pharmacology efficiency of the first tetracycline, and that's when you have your doxycycline. Now that's the history done. Let's move on to the mechanism of action. Now I'm just going to explain a little bit more regarding the mechanism of action of doxycycline itself. Now doxycycline is actually a bacteriostatic drug, which means it just inhibits the bacteria's ability to grow. Now how it does it specifically is basically you have to know the function of the ribosome in the internal cellular machinery of the bacteria as well. So ribosomes are used to synthesize proteins that will facilitate growth within the bacteria, right? So what doxycycline is going to do is it's going to go into the one of the subunits of the ribosome, and it's going to clamp onto this guy, and it's going to prevent any protein synthesis from happening. Now if there's no protein synthesis, the bacteria cannot grow, so thus the bacteria dies due to lack of growth, and this is how doxycycline is bacteriostatic in nature. I'm just going to give you some just basic facts regarding doxycycline. Now, generally, if you go to the pharmacy, you're going to find this drug under its brand name, under its company name. So generally, the most famous brands will be Oracea, Vibromycin. Doxycycline price is around 0.01 to 0.04 cents per pill, according to US currency. And doxycycline is actually used against most bacterial infections, regardless whether it's gram-positive or gram-negative. So it classifies itself under as a broad spectrum of antibiotics. So it's basically used during most empirical therapies when your diagnosis is not quite accurate. Now, few bacteria to be named that doxycycline can be used against is going to be E. coli, Haemophilus leukreae, Shigella, and many more other bacteria as well. Now, doxycycline can also be used against most malarial infections as well. Not most, but specifically we're going to talk about Plasmodium falciparum, but it's not strong enough to be used alone. It's normally used in coherence with another drug as well. It's also used against a helminthic infection, but in this case it's only going to work against one specific helminth known as Wolbachia, which causes elephantiasis. Now we're going to look at the pharmacokinetics aspect of the drug doxycycline. Now it's important to know that doxycycline is mainly given in oral tablets. You have the delayed form and you have the immediate released forms, and it's also sold in oral suspensions, which means you can have liquid forms as well. Now, a few pharmacological facts regarding doxycycline would be it's highly lipophilic. It has a high volume of distribution, and this will also, of course, indicate that it has a high half-life as well. Now, it's also important to note that when you take doxycycline, you should not be consuming any multivitamins, any iron tablets, magnesium tablets, because this will definitely affect with the absorption of doxycycline in your gut, and it's going to cause the ineffectivity of using the medicine in the first place. Now, next up, we're just going to talk about the adverse drug reactions. Obviously, whenever you're consuming a new drug, you should know the possible adverse drug reactions that you can get from the drug. So the most common documented reactions that humans face from consuming this drug will be loss of appetite, nausea and vomiting, and diarrhea, which are basically common side effects that you can get with any type of antibiotic use. And most serious drug reactions will be development of pancreatitis and also serious skin rashes. Yeah. We're going to look at few cases of contraindications when doxycycline cannot be prescribed towards the patient. Now, of course, if you're allergic to the tetracycline class of antibiotics, doxycycline will be contraindicated. Also, in children who are below 8 years of age, doxycycline is not allowed as it can develop a permanent teeth yellowing as well. Now, it's also been documented that doxycycline is able to cross the placental barrier. So, in mothers who are pregnant with usage of doxycycline, there's also been documented cases of retardation of skeletal development within the infant as well. Doxycycline is also not allowed for use if you have recent colitis from antibiotic use as well, because you know that if you take antibiotics, it can sometimes disrupt the normal flora present in your gut, and it allows the growth of other bacteria, for example, in this case, Clostridium difficile. So if you have recent history of this, you're not allowed to take doxycycline as well.